Gentleman from Colorado is recognized.
Thank you, Mr. Speaker. Republicans believe that we can have health reform, and we should, without a government takeover of 1/6 of our nation's economy. Republicans have introduced over 70 bills that offer free market solutions to health care reform, and one of those is H.R. 3400. H.R. 3400, a bill I have co-sponsored, is the Empowering Patients First Act. It does three things. It gives access to coverage for all Americans. It does this in large part by extending the tax deduction, which right now unfairly only goes to corporate employees, and says every American can have this tax deduction. That lets you have your insurance and not be dependent on your job to provide it for you. That way you can take it with you. It becomes portable. You have less to fear from pre-existing conditions. Coverage will be truly owned by the patient under H.R. 3400. The individual market is expanded. Things like pooling mechanisms where national associations can form together, use national economies of scale to form membership plans and accounts to pool across state lines. Right now, that is not allowed under law. And reining in out of control costs. We can do this, for instance, through reforming the medical liability system. The bills in front of us that we may vote on tomorrow do nothing about medical tort reform. That's a huge driver of defensive medicine and needless costs in our healthcare system. But if we, for instance, established administrative healthcare tribunals, known as health courts in each state, added affirmative defense through provider-established best practice measures, or encouraged the speedy resolution of claims, we would do things to cut down on the cost of defensive medicine. So Republicans have solutions that unfortunately have not been allowed to come to this floor for a vote. We also have about 100 votes being heard as we speak over in the Rules Committee, and I doubt that a single one of those rules will be labeled in order for voting on the floor tomorrow. Let me conclude by reading some lines out of today's Wall Street Journal. They have summed it up better than anyone can. This is the lead editorial in today's Wall Street Journal. A self-governing democracy, it concludes, can of course decide what it wants, that it wants to become this kind of super welfare state. But if the year-long debate over Obamacare has proven anything, it is that Americans want no such thing. There is no polling majority or any bipartisan support, much less a rough national consensus for this expansion of government power. The election of Scott Brown in Massachusetts for Ted Kennedy's seat, of all things, was as direct a referendum as you could have. If the health bill passes in the House, it will only do so the way it did in the Senate, with a narrow partisan majority, abetted by political bribery and intimidation, budget gimmicks, and procedural deceptions. Thank you, and I yield back.
The gentlelady from Guam.